Right, it's my job here today to tell you about what Mental Health North East has done to organise for the changes that are hitting us. Now, in actual fact, about 2 years ago, our then Board of Directors in Mental Health North East team, consisting of volunteers and members of staff, started to look at what were we going to have in 2 years, 5 years, 10 years' time. What would the situation look like politically, economically and structurally? The one thing we did get right was that there was going to be a coalition government. But we didn't have a crystal ball, and nobody, I think, could have forecast the huge changes that were to come. We did know, however, that hard times were to come for Mental Health North East, our members and the people who use their services. We knew that there was going to be less money about. We knew that there was going to be a need for our members and ourselves to behave in a more business-like fashion. And we knew we were going to have to be prepared to change our way of working and thinking without compromising our principles. So, can we have the structure diagram here, please? What we did is we embarked on a radical restructure of Mental Health North East and also moved premises at the same time. So the first thing we looked at was our Board of Directors, and we had an absolutely excellent Board of Directors. A very talented group of people who incidentally were all drawn from our member organisations and represented regions, Gateshead, Newcastle, South Tyneside, etc. But there were two problems. Those directors were absolutely dedicated to working on service improvement, but as directors of mini board, they actually spent a lot of their time on governance, legal issues, financial issues. The other problem was we all worked in the same sector. We shared a lot of the same contacts, the same ideas, and we needed to recruit a new board with different experiences, knowledges, different contacts. So if you look at our new Board of Directors chaired by Kay, they're people from very different backgrounds. There's a consultant psychiatrist on that board. Johannes has come on as a GP commissioner. We also have a solicitor on, people from legal backgrounds. So we've started to enter into new arenas, and when Mental Health North East goes into different arenas, finds out different things, we share that with our member organisations. So I think we have still retained an actual member on the board who represents the membership, and we have been very clear about having a regional service user and carer representative also on our board. So a very new board who's looking at things in a very different way. However, does anybody escape Mental Health North East very easily if they do show a bit of talent? And the answer to that one is definitely no. So those skilled people who were our directors have now come on to the Regional Advisory Forum. And the Regional Advisory Forum is our opportunity to get people from the different localities together. It's an open meeting, all of our members are entitled to attend. And we're looking to improve service delivery and outcomes where we can, to collect and share intelligence, to campaign and lobby. And that's a big change for Mental Health North East. We started to do some research into the personalisation agenda funded by Millfield House Foundation, and they said you're collecting some excellent information, but you need to be sharing it. And they propelled us in a lot of ways to do what's going to be actually a vital function in future, to collect evidence on what is happening on the ground, what the impact of these changes are to ordinary people, and to tell the decision makers about what they are and what needs to happen in relation to them. And this group also brings us together to share good practice and indeed to learn from each other's mistakes. And I think when we first set up the Regional Advisory Forum, I really underestimated its importance. At its last meeting, which was only on Tuesday, we got together and there's all sorts of very interesting things that are happening throughout the region. Some very worrying things, where one local authority has told the voluntary organisation that it funds, you mustn't tell service users that your services are going to go, because that will worry them. But of course our member organisations need to tell service users, because we need to prepare for changes in a proper and sensible manner. So I think that's going to be a very important forum. The other thing we brought in with SEEN, which is our business arm, with a wholly owned subsidiary of Mental Health North East. Now, I'm not going to talk a lot about SEEN because we've got David Sutton, the managing director of SEEN, to talk a little bit more to you. But what I am going to say is we are forming relationships in Mental Health North East with the private sector. Now, I know they're sometimes regarded as the bad guys, and they very often are, but they're also smart cookies. And I can tell you my house is a testimony to that. It's a testimony to marketing. All the useless stuff that I've got that I never use. You know, so we can learn things, because a lot of our member organisations run excellent services, but they're so used to doing it they don't tell anybody. And we need to publicise those services now more than anywhere else. In the changed position that we're in, I can tell you that Neil Kelly and myself had somebody to see us, a young man, just before Christmas, and he came to see us and he said, I represent the world's second largest employer. We looked it up and that's actually true, he does. So what was he doing at Mental Health North East's doorstep? Since then I've had a lot of nice emails from him. Is it because I've got bonny blue eyes? No, it isn't. It's because the private sector, who intend to sweep up the big contracts in our area, they need our member groups. Because we are the ones who actually meet the people at grassroots level. So it's very important that we don't underestimate our worth at this particular point in time. But we've called this event Meet the Challenges. And I'm going to end up with a challenge to all of you in the audience. We all know that there's been a lot of concerns about how Mental Health North East have changed. Have we abandoned our principles and our ideas that we very much share with our member groups? These concerns, has many forgot their core values? Will SEEN forget why it was established and go off in another direction? They're real concerns. We all know about building societies that were set up for people to help people buy homes, turned into banks and ended up evicting people from homes. Very real concerns. I feel that we've set up a solid structure that doesn't compromise our shared values. But my challenge to all of you today, that if you think our board of directors, our forum, all SEEN on holding on to those principles, my challenge to you is to tell us that. And to promise you, and I know Kate, our chairperson, will back that up, that we will retain our promise to you and we will look to protect services to our members. Thank you.